We have a lot of patients coming in and they say, Doctor, I think I have a heart attack. The fact is, however, that most people who think they have a heart attack, they don't have one. But a heart attack is a potentially life-threatening condition. So if you really believe you have a heart attack, then you have to call 911 or go to the next ER. Don't drive yourself. So let's talk a little bit about a heart attack. So the typical scenario for a heart attack is that there's an artery in the heart. We call that the coronary arteries. And those arteries supply the heart with blood, with oxygen. And if one of the three major arteries or one of the major side branches is suddenly blocked, completely blocked, then no blood can flow through the artery, meaning the territory of the heart muscle provided by that particular artery doesn't get oxygen and as a result dies. That's a heart attack. Meaning cells go down the hill, they die. That could be a few cells, it could be a small area, it could be a large area of the left chamber, usually of the heart. And every single event, like I said, is a potentially life-threatening thing for a couple of reasons. One is there's no oxygen supply, and as a result of that, the contractile function, meaning the pump function of the heart, goes instantaneously downhill. There's no contraction, so the heart, if it's a large area affected, can stop. It can't pump anymore, and that can cause sudden death. Besides that, even a small heart attack can cause irregularities of the heart, life-threatening arrhythmia, and people can die of sudden cardiac death because of an arrhythmia as a result of the lack of oxygen in the heart. That's why many patients who have a heart attack don't even make it to the hospital because they die at home. So what causes a heart attack? I mentioned an occlusion, a complete blockage of one of the arteries in the heart. Why does that happen? Usually it happens because of plaque formation in the arteries of the heart, calcium plaques, cholesterol plaques. They progressively reduce the luminal reduction of the artery, and then either it comes to complete blockage or they rupture, the plaque ruptures, and that causes the accumulation of platelets in the flowing blood, and that causes a clot, a thrombotic occlusion of the artery. And the treatment is usually, we need to open that artery as quickly as possible because time, as we say, is muscle in that case. The longer it takes to open that artery, either with medication or with catheter interventions, the more heart muscle goes down, the more long-term damage. Keep in mind, in the heart, same in the brain, by the way, whatever tissue dies off is irreplaceable. The body doesn't have the ability to replace or rebuild or repair damaged heart or brain tissue, in contrast to some other organs like our skin, like our liver, for example. But we don't have enough stem cells, for example, to do that in our bodies. So that's another story for another video, actually. But coming back to the scenario. So if there's no blood or not enough blood in the heart supplying the heart muscle with oxygen, that usually causes characteristic symptoms, in particular chest pain or pressure, but severe pain or pressure. Some people come to us and they tell me, oh, doctor, it hurts here, there's a little stabbing pain. That has nothing to do usually with the heart. That's more like musculoskeletal. But if someone tells us, doctor, it feels like an elephant sits on my chest, real severe pressure or severe pain, that's dangerous. That's always suspicious. And it can be really severe, and some people just feel something there which doesn't belong there. And often those symptoms are distributed into the jaw or usually the left arm, left shoulder, or left arm. So that's very suspicious. Keep in mind, however, that in women, more often we have what we call atypical symptoms, not the classic angina, chest pressure type of pain as I mentioned right now. There's a large variety of symptoms. Some people even feel just abdominal epigastric pressure or pain. Others feel shoulder pain. Others feel severe shortness of breath, severe fatigue, or even pain with nausea. All those symptoms need to be evaluated because we always have to make sure it's not something life-threatening from the heart. So usually, as I mentioned, there's an acute occlusion, a blockage of one of the arteries, which then causes a lack of oxygen, which then causes a pain, which then causes the necrosis or the death of the heart muscle cells. But oftentimes patients who have a heart attack, they have symptoms for quite a while before, in particular the chest pressure or pain with physical activity, which might be normal or normalized at rest. So if they run or if they go upstairs, it hurts, and then when they rest, it goes away. That's very suspicious. In that case, the artery is probably not blocked completely, but partially, and it could lead down the road to a heart attack. So what leads now to that blockage of the arteries? It's atherosclerosis or coronary artery disease. And those symptoms, of course, and those conditions have certain risk factors. And the risk factors for that are manifold, but I just name you the major risk factors. And those ones we can and we have to address and avoid if all possible. The number one risk factor, which we all can address and avoid easily, is smoking. Smoking causes severe buildup of plaques as well as a coronary spasm, meaning lack of oxygen. So smoking is the number one avoidable risk factors for the development of coronary artery disease leading to heart attacks and strokes also. The next one is high blood pressure. High blood pressure, uncontrolled hypertension, is a major risk factor. And it's very dangerous for a couple of reasons. One of the main reasons is it affects the heart muscle, can make the muscle bigger, and by the increased mass of the heart, basically it can weaken. It can affect the arteries and can cause the calcification and the plaque formation in the arteries. And make it worse, it doesn't hurt. People don't know if they have high blood pressure until they measure it. Most people don't feel anything about it. So they don't know if the blood pressure is 110/75, as it should be, or whether it's 155/95, which is way too high. And because it doesn't hurt, we call that the silent killer. So blood pressure is a major thing which needs to be addressed. So the next one is diabetes. So diabetes is another major risk factor. High sugar levels, uncontrolled diabetes affects the large and the smaller arteries, and that can affect the heart, can cause weakness of the heart, can affect the kidneys. A lot of people end up on dialysis, can affect the brain and every single organ in our body. So smoking, high blood pressure, diabetes. The next one is high uncontrolled cholesterol level. Cholesterol is very important to build certain of our hormones. So we need some cholesterol, but too much of the cholesterol leads also to the buildup of cholesterol calcium plaques in the arteries and is considered a major risk factor for the development of coronary artery disease, heart attacks, and strokes. And there's other what we call more secondary risk factors, which include obesity, sedentary lifestyle, lack of sleep, and a few others, including, very important, but can't manipulate it really, is a positive family history, first and second generation. We always want to ask patients, in your family, your parents, grandparents, is there any heart attacks, is there any cardiac diseases in the past? If you have a positive family history, that puts you at a higher risk too. And then you have to be even more aggressive with the risk factor reduction. So in the very near future, we talk about how we reduce those risk factors. But for now, just keep in mind, if you have severe chest pressure or pain, especially going to the jaw, into the left arm, shoulder, ask your physician right away. If it's severe, call 911, go to the next ER. Good luck.